angiotensin-converting enzymes inhibitors and angiotensin II receptor antagonists are currently the best in the list of antihypertensive agents. Conventional IC inhibitors replace ARA II when side effects develop, especially cough. But even regardless of the side effects, it is useful to periodically change IC inhibitors to ARA II, remembering that after a couple of months, their antihypertensive effect can seriously decrease. In this way, you will prevent the effectiveness of these drugs from decreasing due to better blood pressure control at lower doses. On the right, in the tables, you can see the lists of drugs in both groups. You can use any drugs from this list, but the result will be better after testing them in acute pharmacological test.